I'm Dr. Roy Fleischmann from the University of Texas Southwestern Medical Center and the Metroplex Clinical Research Center in Dallas, Texas. I'd like to present the safety results as assessed by laboratory measures of the oral selective allosteric tyrosine kinase 2 inhibitor deucravacitinib from a phase 2 trial in psoriatic arthritis and 2 phase 3 trials in psoriasis. With respect to background and purpose, TYK2 is an intracellular kinase that mediates the signaling of multiple cytokines involved in the immunopathogenesis of psoriatic arthritis, such as IL-23. Deucravacitinib selectively inhibits TYK2 via a unique allosteric mechanism distinct from JAK1/2/3 inhibitors. In the phase 2 trial, deucravacitinib was significantly more efficacious than placebo after 16 weeks of treatment in patients with active psoriatic arthritis. In 2 phase 3 clinical trials, deucravacitinib also showed superior efficacy compared with placebo and apremilast in patients with moderate to severe psoriasis. The objective of these analyses was to assess the effects of deucravacitinib on multiple laboratory parameters, which are known to change on treatment with JAK1/2/3 inhibitors. With respect to methods, the current analyses were conducted utilizing data from the first 16 weeks, or the placebo-controlled phase of the phase 2 psoriatic arthritis clinical trial, and pooled data from the 2 phase 3 psoriasis clinical trials. The phase 2 double-blind active psoriatic arthritis trial randomized 203 patients equally to placebo, deucravacitinib 6 milligrams a day, or deucravacitinib 12 milligrams a day for 16 weeks. The 2 phase 3 double-blind psoriasis trials randomized 1,686 patients equally to placebo or apremilast 30 milligrams twice daily, and twice the number of patients were randomized to deucravacitinib 6 milligrams a day for 52 weeks. With respect to results, the baseline characteristics and clinical characteristics were generally similar across treatment groups in each trial. In the phase 2 psoriatic arthritis trial, 65% of patients reported use of concomitant conventional synthetic disease-modifying drugs, including approximately 55% who received methotrexate. There were no clinically meaningful mean changes from baseline observed in any of the laboratory parameters in patients treated with deucravacitinib, placebo, or apremilast. If you look at the poster, you can see that shifts in laboratory parameters to grade equal to or greater than 3 over 16 weeks were generally rare and overall similar across treatment groups. No shifts from grade equal to or less than 2 at baseline to grade equal to or greater than 3 for neutrophils, platelets, anemia, ALT, and cholesterol were observed in the deucravacitinib treated patients through week 16 in any of the 3 trials. Shifts from grade equal to less than 2 to grade equal or greater than 3 in lymphocytes and AST were rare, occurring in single patients in those treatment arms affecting the phase 2 psoriatic arthritis trial and the phase 3 trials in psoriasis. Shifts from equal to or less than 2 to grade greater or equal to 3 in CPK and triglycerides were low and generally similar across treatment arms, approximately less than 5%. There were no discontinuations due to laboratory abnormalities in the phase 2 clinical trial for patients with psoriatic arthritis. Discontinuations due to laboratory abnormalities occurred in less than 0.2% of patients in the 2 phase 3 psoriasis trials and were balanced across treatment groups. In conclusion, there were no clinically meaningful mean changes from baseline in laboratory parameters over 16 weeks in the placebo-controlled portion of the phase 2 trial in psoriatic arthritis, despite 2/3 of patients receiving conventional synthetic DMARDs, and in 2 large phase 3 trials in psoriasis. Effects on hematological, hepatic, CPK, and cholesterol laboratory parameters characteristic of JAK1/2/3 inhibitors were generally not observed over 16 weeks of deucravacitinib exposure at doses up to 12 milligrams a day, and in the presence of background conventional synthetic DMARDs, although there was an increase in triglycerides in occasional patients for reasons that are unclear.